Kama nilivyosema, basi tayari tumeshaingia kwenye chumba cha daktari, na daktari wa kwanza ambaye tumekutana naye ni mtaalamu naye ambaye ametoka India, ambaye amekuja kwa ajili ya kutoa tiba hapa za bure kwa wakazi ambao wamejitokeza. Kusema kweli ni mtu ambaye tungesema kumkuta India ingekuwa ghali sana, lakini hapa kidogo amepatikana na sisi tunashukuru. Kwa hiyo kwanza kabisa ningemuomba ajitambulishe, lakini pia baada ya hapo swali la pili ambalo nitamuuliza ni anaonaje hali za afya za Watanzania ambao amewaona, lakini pia ana ushauri gani kwa Watanzania. Hao ndio maswali ambayo nitamuuliza. So doctor, I was just telling them what I'm about to do. So first and foremost, thank you for coming to Tanzania.
Welcome.
I would like for you to start by introducing yourself.
Yeah, my name is Dr Deepashree G.A. I'm a consultant nephrologist from Bangalore Apollo Hospital, Bannerghatta branch. So I'm a consultant nephrologist and as well as a transplant physician. We are more into the renal cases, that is more of acute kidney injury, chronic kidney disease and transplant. We do a lot of kidney transplantation. Like every year we do around 45 transplants. So kidney transplant, we have done most of our international patients also from Ghana, Uganda. We have done a lot of kidney transplants. And also we have our local patients, Indian patients, where we do a lot of complicated cases. Our cases are not like the usual transplant what we do. We do a very complicated cases. Like we have done some couple of transplant, first transplant failure, second transplant failure, third transplant we have done. We have done across the blood transplant. We have taken elderly donors as our donors, generally the borderline age donors, like even 65, 72-year-old donors we have taken as a transplant donors after working up them if they don't have any major issues and they are acceptable as a borderline donors. And also who are borderline hypertensive, early diabetic, also some cases we have taken when they don't have an alternative donor. And some complicated cases like, the nephrocalcinosis, primary hyperoxaluria, with the recurrence of stone we have worked up, we have done a kidney transplant. And some unusual diseases which is not done there is something called as familial hypoglycemic hypercalciuric nephrocalcinosis. That also we have done a transplant. It is 5 years, almost like 3 to 4 years post transplant. He is doing well on follow up. And our transplant success rate is good in the sense around our graft survival is good. We don't have much rejections because our immunosuppression is quite efficient. Hardly we see any rejections. Even if there are rejections, we have treated. We also had recently something called as antibody mediated rejection. It was like we thought, and also there was a severe ATN, and the kidney was actually not functioning for 1.5 months. Almost 1.5 months we had to support her with dialysis, and we treated for rejection also. But now the kidney started working, the graft is working well, it's back to the normal renal parameters, not to the normal graft function. That means the kidneys are normal now. So that so we have a kind of not a routine cases, like even HIV patients we have done a transplant, hepatitis C virus patients we have done a transplant, hepatitis B virus patient has undergone a transplant, and a patient who had a severe LV dysfunction and global hypokinesia, many patients we have done a transplant. There was one patient who had come from Ghana who had a LV apical clot, who had a multiple axis failure, everything. It was a very challenging case. Even then we have done a transplant. He is on follow-up. Even on WhatsApp he follows up with me. So the reports are quite good. And there was some patient, his name is Nana, he's from Ghana. And he had a very elderly donor, very obese donor. No one was accepting her as a donor. She was almost like 69 years. We have done a transplant with that donor.
And that donor was from Ghana as well?
Ghana itself. Mother was a donor.
Oh.
Yeah.
Thank you.
So these are a kind of cases which we have done. We are more into CKD, dialysis, transplant, and and peritoneal dialysis. All these kind of cases we handle.
I'm interested in peritoneal dialysis, but we'll talk about that later.
Yeah.
And also I wanted to know if you have quite a good number of patients that are coming from Tanzania, but before you answer that question, let me translate this for people who do not understand English.
Sure.
So I'll switch real quick and speak Swahili.
Definitely.
Okay. Kama ulivyomsikia ni daktari bingwa kabisa wa mfumo tuseme wa figo, kwa sababu ni nephrologist, mishipa ambayo inahusiana na figo, na amezungumza kwamba yeye anatoka hospitali ya Apollo, moja ya hospitali za Apollo, hospitali kubwa kabisa India, na amesema kwamba wamekuwa wanafanya kazi kubwa sana ya kusaidia watu ambao wana changamoto za figo, ikiwemo kubadilisha figo, ambapo amesema wanafanya renal transplant, maana yake wanabadilisha figo, na wao hawafanyi ubadilishaji wa kawaida, wanafanya ule ubadilishaji ambao ni mgumu, sio wa kawaida. Kwa hiyo wao wanadili na wagonjwa wagumu, ikiwemo kwa mfano watu ambao wanataka kubadilishiwa figo, anapewa figo na mtu mzee kabisa mwenye miaka 60, 65, na anapata figo lake, analitumia figo na anakuwa hana shida yoyote. Amezungumzia kwamba wanadili na wagonjwa ambao wanahitaji figo lakini wana magonjwa mengine, wagonjwa wenye virusi vya ukimwi, wagonjwa wenye saratani, na wagonjwa wenye magonjwa mengine, ikiwemo wagonjwa wenye magonjwa ya moyo ambao ni magonjwa ambayo kimsingi inakuwa ngumu kidogo kuweza kufanya swala la kumbadilishia mtu figo, operations za figo. Lakini pia amezungumzia kwamba anafanya pia kazi ya kuweza kusaidia watu sio tu waweze kuishi na figo kwa muda mfupi, lakini muda mrefu, kwa sababu wao kama hospitali wamekuwa tunasema rejection, yani mtu akipewa figo alafu mwili ukatae, wamekuwa wanapata matokeo machache sana ya watu ambao wanapata hilo tatizo, kwa sababu wana utaratibu mzuri sana wa kufuatilia, wanatoa dawa nzuri sana za kupunguza huo uwezekano wa kukataliwa kwa figo jipya na mengineyo. Kwa kifupi ni kwamba amezungumzia namna ambavyo wanafanya kazi sana ambazo zinasaidia watu ambao wana changamoto za figo. Mimi swali ambalo nataka nimuulize sasa ni kuhusiana na wagonjwa kutoka Tanzania, kwa sababu amesema anapata wagonjwa wengi sana kutoka Ghana, kutoka Uganda na kutoka nchi nyingine. Sasa nataka nifahamu kama anapata wagonjwa kutoka Tanzania, na ndio swali ambalo nitamuuliza. So doctor, do you get patients from Tanzania? And if you get per year, how many do you get?
We have got most of the patients from Ghana and Uganda. We have just started getting patients from Tanzania. Maybe like one patient, and there are a couple of cases like cardiothoracic, they are getting a lot of cases. Nephrology wise, we have just started. So cardiothoracic, I think they're doing every month around 1 or 2 cases. So for nephro point of view, we have just started. We have very more cases from Ghana, Uganda and all that part. But however, from Tanzania, we have like around 1 case or something like that. Yeah.
So if there are patients that are trying to get treatment from India, they can just come, right?
Definitely they can come. They're welcome to come. So the transplant and all, no, we can actually work up them properly and give a very good quality of a transplant. And post-transplant also, they have to kind of follow up. That is also very important.
Alright, thank you. Amesema kwamba hawajapokea wagonjwa wengi sana kutoka Tanzania, kwa sababu ndio kwanza wanaanza kufanya kazi Tanzania, lakini wanapata wagonjwa wengi sana kutoka Ghana na wagonjwa wengi sana kutoka Uganda. Kwa hiyo kama kuna mtu ambaye ana mgonjwa hapa Tanzania, nadhani ni fursa, kwa sababu kama ndio program inaanza, maana yake ni kwamba unaweza kupata huduma bora kabisa na pia kwa gharama nafuu. So swali jingine ambalo nataka nimuulize, kwa nini kuna ongezeko kubwa la wagonjwa ambao wana changamoto za figo? Yeye akiwa kama mtaalamu anasemaje? So I don't know if it is true because I do not have any evidence, but from the look of things, we have been seeing a lot of increase, or at least a good, a significant increase in patients of renal patients, people who have problems with their kidneys. Do you also see the same?
Yes, we do see the same. This is because the thing is, they're not going for the early evaluation. The thing is, if they are diabetic or hypertensive, they don't follow up sometimes, and routinely what I feel is they have to do their urine analysis and their ultrasounds and all every 3 months or once, at least the urine analysis, because it is an early indicator which tells us there is some kidney problem happening in the patients. If there is some proteinuria or the RBCs in the urine, it indirectly tells that immediately the physician should refer to a nephrologist so that we can take care of the kidney at the early point of view. So that we can prevent them for the progression of the kidney disease, CK, ESRD, and getting into dialysis and transplant. So at least we can recover whatever possible we can treat. So that is one thing. And second thing is some conditions are genetic. So that we cannot do anything about it. And a few stone disease and all, it is all hereditary. Hereditary nephritis, hereditary, the renal calculi disease and all comes from the genetic point of view. And what the thing is, even after so much of awareness, people still go for alternative medications, taking painkillers without any prescription. Still do they take painkillers and they don't follow up. And third thing is they take some alternative medications after they know that they have a renal issue also. They go for a herbal alternative. Even in India, they take a lot of herbal medications, siddha medications, unani medications, which would actually worsen the renal parameters. And once they keep their blood pressure and their diabetes under control, most of the things would be under, like, we can can be controlled. But the things are, they come when the things are out of control. Most of the time they don't know the symptoms. Sometimes they come without symptoms, sometimes they come with symptoms. Some patients do not have any symptoms. They present at the, they just come with something like loss of appetite, weight loss. Then when we evaluate, then we find to have a renal dysfunction. But exactly what is the cause? Sometimes the kidneys are very small when they present to us, so we can't biopsy them. We can have only the indirect parameters to what could be the probable kidney disease. But what exactly is the etiology? To know, we have to biopsy and see the kidney. But by the time they present to us, it is too late, where we can actually give them the proper, what is the cause for the CKD.
So you're saying that there is an increase in renal problems
Definitely
globally.
There is increase in renal problem. Yeah.
Not just in Tanzania. We thought it's just in Tanzania.
No, in Tanzania and India also we have a couple of renal cases now.
Okay. So let me translate that and then I'll come back with another question.
Yeah.
Which will be what should we do now to stop that? Daktari amezungumza, nilimuuliza swali kama yeye pia anaona ongezeko la magonjwa ya figo, na akasema kwamba ndio anaona, na inatokana na sababu mbalimbali. Ikiwemo ya kwanza kabisa ni watu kutokuwa na tabia ya kufanya vipimo vya mapema vya kujua kama wana changamoto za figo. Kwa hiyo matokeo yake ni kwamba wanapokuja kugundua kwamba wana shida, wanakuta tayari changamoto imeshakuwa kubwa. Lakini pia amezungumza swala la watu kutumia dawa bila kupewa taratibu, yani bila taratibu, kwamba unaenda unachukua tu dawa za maumivu unakunywa, kitu ambacho kinaharibu figo. Na pia akazungumza kuhusiana na matumizi ya mitishamba, kwamba hata India napo wanakunywa na mengine, na hii bahati mbaya inaharibu zaidi afya ya figo. Kwa hiyo hizo ni changamoto au ndio sababu tatu ambazo pengine zinaonyesha au zinapelekea kuona ongezeko la changamoto za figo, pamoja na tabia sasa, ikiwemo mambo ya urithi. Kuna magonjwa ambayo yanarithika ya figo ambayo yanakuwa ni kutokana na ambapo huna cha kufanya, lakini pia kuna aina ya chakula unachokula na maisha unayoishi. Nikasema nitamuuliza swali la mwisho, sasa tufanyeje ili kuepuka hii changamoto? Sasa tumsikilize. So doctor,
yes,
what should we do as people to stop the trend?
So to stop the trend, what I feel is, if they know they are diabetic or hypertensive, first of all, to keep their disease under control, the diabetes under control and hypertension under control, and to have a regular monitoring of the investigations, like other basic urine analysis. That itself will give us a clue if there is any proteinuria or there is any RBCs. So whenever there is something abnormal, sediments which are seen in the urine, refer to your nephrologist at the earliest, so that they can take care and they can see what is the cause. If there is an early need of biopsy, there is some RBCs in the urine, hypertension, so we'll know what is the cause for the hypertension. Is the renal is a cause, so they can do a biopsy and can treat, and so they can prevent the progression of the kidney disease. Second thing, not to take any alternative medications, like to avoid taking like painkillers without any prescriptions, and also some herbal or Unani medications without knowing what is the side effect of the medications, because we don't know for whom what will happen. And second thing, if they're having symptoms, say they are observing some frothiness in the urine, just don't neglect. If there is some blood in the urine, don't neglect. And if you are passing around 3 to 4 times urine in the midnight, or they're having non-specific pain in the body, like joint pains, body pain, prolonged fever, rashes, joint pain, ulcers, hair loss, anything which is abnormal symptomatically, better to come and see. If there is a loss of appetite, early morning when they're brushing, they feel like nauseating, vomiting and all, please have your blood checks. And once you know there is some kidney problems, have a routine follow-up. Don't miss the follow-up and don't miss the diet. Very important is the diet. Whatever the diet the renal physician gives to you, please follow the diet. So the diet is very important. Nutrition is very important, and following meticulously medications is important, and having a proper follow-up every 3 months to 6 months, having a proper follow-up is very, very important at this point of time. This is how we can prevent them from progression of the disease. In case there is any early thing, we can immediately do a biopsy, treat, and so we can save the kidneys.
Thank you so much.
Welcome.
Let me translate that real quick before I forget,
Yeah.
and then I get back to you.
Sure.
Hili ni swali muhimu sana kwa sababu nimemuuliza tufanyeje ili kuzuia changamoto isiongezeke ya figo, na amezungumza kwa kirefu sana. Kwanza kabisa, kwa wale ambao tuna magonjwa ya muda mrefu, magonjwa ya kisukari, pressure, ni lazima tufanye vipimo vya figo ili kama kuna changamoto tuweze kuchukua hatua haraka. Lakini pia hata sisi wengine na sisi tufanye check-ups, tuangalie kama tuna changamoto za figo, tuzifanyie kazi. Na pia amezungumza umuhimu wa kuacha kutumia dawa ambazo hatujapewa kwenye prescription kwa sababu figo linaathirika. Ni vyema kama unaumwa umwone daktari akuandikie prescription ili uweze kutumia dawa. Kingine ambacho amezungumza ni umuhimu pia wa kuhakikisha kwamba chakula unachokula nacho kinalinda figo. Amesema diet is very important. Kwa hiyo chakula unachokula lazima uhakikishe kina nini ili kiweze kulinda figo lako, tusile kule tu hovyo. Na pia amezungumza umuhimu wa kuhakikisha kwamba sio tu kwamba ukiumwa unakuwa unavumilia, lakini enda hospitalini. So thank you.
Welcome.
Now before I finish, I would like to say first thank you.
Welcome.
For coming to Tanzania. I really am thankful on behalf of those who benefited from you coming here, and I would like also to know if you are still here or if you are leaving, and if you are leaving, some of us who missed the opportunity, how can we get in touch with you?
I'll be there till tomorrow afternoon. So we're planning to leave tomorrow afternoon. I have given my cards and I've given my email ID, and so they can contact me any point of time. And all of the patients whomever I've met, I've given my personal contact number also. They can WhatsApp me their reports or if they have any queries. And I've also given my email ID, so they can WhatsApp mail me their reports, or if they have any queries, they can meet me. And if they still want, any of the patients want to meet me, I have my WhatsApp number, so they can call me, so I can guide them.
All right.
Yeah.
Thank you again.
Welcome, and thank you so much for me also to come here and to get an opportunity to see all the patients of Tanzania. I really had a good time here.
Thank you so much.
Yeah.
We appreciate it.
Yeah.
Naam, naamini umepata elimu ya kutosha kabisa kuhusiana na afya, kuhusiana na saratani. Hiyo ndo kazi yetu. Sisi kazi yetu tunaifanya vizuri kabisa, na tunaamini wewe unajifunza mengi. Sasa hapa manake ni kwamba dozi imekuwa kubwa, inabidi tupumzike. Kwa leo hii tuishie hapa. Tutakutana tena wiki ijayo kwa ajili ya afya check nyingine. Tutakuwa wapi? Tutakuwa tunazungumzia kitu gani? Kikubwa uendelee kuwepo, na kama una swali endelea kutuuliza kupitia platform hizo ambazo unaziona kwenye runinga yako. Lakini pia kama una changamoto ya kiafya, karibu sana hospitali ya Heameda ambayo ipo Bunju B hapa. Kama nilivyokuambia, kuna wataalamu wengi sana, mtaalamu wa moyo na mishipa ya damu, wataalamu wa saratani, wataalamu wa magonjwa yanayohusiana na figo na mengine yoyote. Unaweza ukaja hapa ukapata huduma. Unaweza kuwasiliana nao kwa namba hizi ambazo unaziona kwenye simu. Mpaka wakati mwingine tutakapoonana tena, mimi naitwa Isaac Maro, na always nazungumza, endelea kutunza afya yako kwa sababu it's all you've got. Stay safe.
Kwenye AfyaCheck.